This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association, Watch Wisconsin Eye on Spectrum Channels 995 and 363, and at wisi.org.
Good afternoon, and thank you for joining us for today's briefing, which is being aired live on YouTube. A reminder, to maintain audio quality, please remain muted until it's time to ask your question. If you're on the phone and you're able to do so, use *6 to mute and unmute. We also remind you that we have a hard out today at 2:15, so please, just one question per reporter to give as many people as possible a chance to ask a question. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-designee Andrea, and available to answer questions are Dr. Ryan Westergaard, Chief Medical Officer in the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel in the Office of the Governor. And we will begin now with remarks from Governor Tony Evers.
Good afternoon. As many of you know, we've put our federal CARES funds to good use over the past few months, working to meet the needs of workers, employers, farmers, and families. Because of our federal CARES funds, the Wisconsin National Guard has been able to collect a total of more than 930,000 specimens at community-based testing sites and institutional-based testing missions. Because of our federal CARES funds, we have been able to provide more than 15,000 farmers with direct aid to keep their farms operating. We've been able to help families pay their utility bills, and we've helped more than 14,000 households make their rent. We've helped folks with child care, broadband access, and finding affordable health care, all of which we know are critical lifelines for working families. We also announced today that 663 Wisconsin hotel and lodging operators and 96 live music and entertainment venues across Wisconsin will be receiving more than $30 million in grant funding through our CARES funds. And we announced an additional $45 million for the Wisconsin Economic Development Corporation's We're All In grant program for small businesses, specifically targeting local Wisconsin restaurants. To date, we've invested more than $220 million in Wisconsin businesses, and our first two application rounds have helped more than 50,000 small businesses. And we've invested $131 million aimed at addressing healthcare worker shortages and helping create capacity in Wisconsin's hospitals and skilled nursing facilities. This is all to say, from testing and contact tracing to helping folks make ends meet, our federal CARES funding is critically important to our state's response to this pandemic. In January, we will still need testing, contact tracing, and PPE. Wisconsinites all across our state will still need to pay rent and keep the heat on, and businesses, farmers, and nonprofits will still be fighting every inch to keep their businesses operating. While the federal funds expire on December 31st, the need does not. And that's why today I sent another letter to Wisconsin's congressional delegation calling on them to act quickly to provide additional support for our state response. At a minimum, to continue our response for just the first quarter of 2021, we will need an additional $466 million. That estimation includes $10 million for vaccine infrastructure readiness and $2 million for public health awareness and vaccine education programs, which will be critical in the new year. But we not only desperately need additional federal funds and resources to continue our state's response, we also have an imminent need to be prioritized to receive vaccine shipments given the surges of COVID-19 in our state. Wisconsin is uniquely facing challenges that other states are not. While other governors are working to turn the dial as their state surges, our statewide mitigation efforts have been struck down, enjoined, and are currently the subject of ongoing litigation. And that includes even the most basic tools like our public health emergency declaration and statewide face coverings requirement. And while other state legislatures are taking action, some passing handfuls of COVID-19 response bills these past few months to support their state's response, our state legislature also hasn't passed a bill in more than 230 days, and at least one House doesn't plan to come into session before January. Given this, the crisis our state faces is not being able to have a statewide mitigation strategy, coupled with a legislature that has no plan to act. We are asking the federal government to prioritize distributing vaccines in Wisconsin. So today, I also sent a letter to the U.S. Department of Health and Human Services requesting Wisconsin be prioritized for the first vaccine shipments and in quantities large enough to vaccinate all 450,000 members of our healthcare workforce and to begin vaccinating Wisconsinites who are high risk. While other states are experiencing similar surges, Wisconsin faces substantial barriers to implement the statewide mitigation strategies that are utilized by other states and supported by public health experts and science. The next few months will be a critical time for our state. We have a lot of work to do, and we need a lot of resources and support to be able to do it. Global pandemics require more of each of us, more empathy, more compassion, more acts of kindness, less talk and more action, in finding resilience in the struggle we share together. Just more of what we have to do to take care of our families, our friends, and our neighbors. Our frontline healthcare workers know that. Our first responders know that. Wisconsin National Guard members who have been mobilized for the longest activation in state's history, they know it also, as well as our small businesses, farmers, workers, and students. They also know that. As elected officials, we have the privilege and the opportunity to serve the people of our state and rise to the challenges in front of us with some empathy, humility, and urgency. There's no time to waste on political games. I remain ready and willing to work with legislators on a proposal that will not only pass both houses with bipartisan support, but will properly address and fund the needs and challenges of our state without helping to spread this virus even more, jeopardizing our kids in our schools or putting at risk our state's ability to fund health care for low-income families and vulnerable populations during a pandemic. Let's get through these next few months together with empathy, hope, and resilience by looking out for our neighbors, wearing our masks, and staying home as much as possible. So I will now turn things over to Secretary-designee Andrea Palm for her update. Andrea, it's all yours.
Thanks, Governor. Good afternoon, everyone, and thanks for joining us again today. I'll start with an update on the numbers. So here's where things stand. We are adding 4,618 new cases today, which brings our total number of confirmed COVID-19 cases in Wisconsin to 399,708. Our 7-day average of cases is now at 3,596, which is a decrease compared to where we were in mid-November. However, considering the recent holiday and our lower testing rates, it is too early to know if this downward trajectory will stay the course. Wisconsin is still at a critically high statewide disease activity level. Our hospitals are still very strained. 34% of hospitals in our state report a current critical staffing shortage, and 40% of hospitals project that they will have a critical staffing shortage within a week. And today, we're reporting 60 more Wisconsinites have died from COVID-19, which brings our total number of deaths here in Wisconsin to 3,562. Our thoughts, as always, are with the families and friends who have lost loved ones. Our cases are still too high, too many people are in the hospital, and we've lost too many of our friends and neighbors to COVID-19 to ease up now. Now is the time to double down on measures to protect ourselves and each other from COVID-19. By staying home, wearing a mask, practicing physical distancing, and following good hand hygiene, we can stop the spread, flatten the curve, and protect our frontline healthcare workers and most vulnerable community members. Thank you for doing your part.
Thank you. And we will now take your questions. A reminder to keep your phones on mute until it's time to ask your question. And we must wrap up by 2:15, so please, just one question per reporter. And we will begin with Mason Dowling of WAOW in Wausau.
Hi, thanks for hosting this call. My question is for the governor, and I know you already mentioned it somewhat, but I wanted to get your reaction to the plan submitted by Speaker Voss on COVID-19 action in the news that the legislature, or at least the House, or the Senate rather, might not meet until January.
Well, the latter part is very disappointing. It takes, obviously, both houses to act, and apparently the Senate is not prepared to do so. We met with both leaders a couple days ago, I guess, Tuesday, and we received the proposals by the Assembly and have gone through all 50 of them. And the good news is we're hopeful to find common ground on a number of them. There's some that are poison pills, and there's some that we need more information on. So when we do meet to discuss, hopefully we can find some bipartisan solutions. But at the end of the game, it's important that the Senate step up and be part of the conversation. That said, I'll continue to work with Assembly Leader Voss and see if we can find some common ground. I think there's some possibilities that we can do that.
Thank you, Governor. And now we go to Mitchell Schmidt from the Wisconsin State Journal.
Yeah, thank you very much for the call today. With regard to the incoming Senate Majority Leader, he had mentioned made a proposal regarding using some surplus medical assistant funds. I was just wondering if you might be able to weigh in on, is that a feasible option here? Is that something being kind of considered, or would you still be kind of pushing for more of a legislative effort? Thank you.
Yeah, and that's not acceptable. That money is set aside for some of our most vulnerable people in the state of Wisconsin as it relates to health care, and especially our elderly. And so, no, to put some folks at risk to do the right thing, which is to set aside money for testing and contact tracing, that is not a trade-off that I'm willing to make.
All right, and the next question to Rob Sussman from WTAQ in Green Bay.
Thanks for taking my question. From what we know from the CDC and the FDA, we may see the first vaccine approval coming within the next couple of weeks, and the first distribution of vaccines going out to different state agencies very shortly after that. My question for the state health officials is the state of Wisconsin ready to distribute a vaccine as things currently stand, and what is going to be required on the part of the states to get that vaccine to the most people in the most efficient manner possible? Thank you.
Yeah, thanks, Rob. We do anticipate, should one or both of the applications be approved, that we will receive a small allocation of doses before the end of the year. And we are prepared to push those out through what we have designed as a hub and spoke model to folks across the state to get shots in arms for our frontline healthcare providers as quickly and efficiently as possible, and then anticipate additional allocations as more vaccine comes off the manufacturing line throughout the winter and into next year. So we're certainly gearing up and ready for that initial allocation, but we do anticipate that it will be obviously far less than is necessary to vaccinate all of our frontline healthcare providers.
All right, thank you. And the next question goes to Stephanie Hoff from WisPolitics.
Good afternoon. So my question is for the governor. Since the legislature seems like they won't meet, do you have a plan B for COVID mitigation before the holidays come?
Well, we continue to hope that they may change their mind on the Senate side. Another option would be to call special session and see if we can get people together that way. But let's hope that we can convince the Senate to come into session.
Thank you. And let's go now to Danny Maxwell at WKOW in Madison.
Hi, good afternoon, everyone. I was wondering if DHS was going to now go by the new CDC quarantine guidelines of 7 to 10 days instead of 14.
Yeah, Danny, appreciate that question. CDC did revise their guidelines mid-afternoon yesterday, and Dr. Westergaard actually has been digging into them over the past 24 hours, and so I'll kick this question to him.
Sure. Yeah, thanks. It's a topic that a lot of us in state public health and local public health are working hard on to try to be ready to communicate what the new guidelines mean. I think the first takeaway message is that the 14-day quarantine, which is based on the incubation period of the virus, is going to continue to be the safest approach. Right? That is the window during which someone who's exposed to the virus might develop symptoms or might develop infection and be able to spread the virus. So that's what we're trying to prevent against with quarantine, is people who spread it without knowing they have it. So the challenge with that, of course, is that 14 days quarantine is very, very difficult. So CDC crunched a lot of numbers and tried to estimate what is the residual risk if we shortened it to 10 days. And the result was you could get it down to about 4 or 5%, which is riskier than about 1 per 1,000, or essentially zero. But there's potential benefits of doing it that way, which is that it's much less disruptive for people in communities and employers to do it. So it might be worth accepting some risk. The other thing is that it might be easier to get people in communities to comply with quarantine. For example, we've heard that contact tracers, when they interview people who've been diagnosed don't want to share their contacts because it's so daunting to think about having to quarantine for 14 days. So putting all these things together, CDC decided that in cases, provided we do certain things well, like continuing to do symptom monitoring, it might be a net benefit to use a shortened quarantine. And we at the state agree, and we're going to be releasing guidance tomorrow to clarify sort of all the precautions and all of the procedures that we think are the best way to do this. But I think it's a net positive thing, and it's going to give people some flexibility and make quarantine more doable in a lot of settings.
All right, thank you for that. The next question goes to Denise Lockwood at Racine County I. Denise Lockwood. And a reminder, *6 will mute and unmute your phone. Denise? All right, why don't we move on to Scott Bauer at the Associated Press.
Thanks for doing this call again. Governor, I wanted to get your reaction to the Supreme Court not taking up the Trump lawsuit, and specifically wondering if you have any concerns about these questions that were raised not being addressed by the court, at least immediately, and leading to further doubt and potentially in future elections about whether election law is being properly carried out.
Yeah, thanks, Scott. And I thought it was a good decision. I was frankly amazed that it was not unanimous. The claims that the president made and his allies in the three suits were frankly an assault on our democracy. And the issues that were brought up were issues that had been in place for at least 10 to 11 different elections, and to now come in at the last minute and say somehow the procedures were wrong, even though they were consistent with past practice and WEC decisions, it's just such a horrible stretch. It would have disenfranchised hundreds of thousands of people in the state of Wisconsin, and frankly, I'm surprised that some of the court were seemingly willing to do just that.
Thank you for that. The next.
I think one other thing to add, Scott, is in terms of the concern about addressing guidance that's been issued by the Elections Commission or others, is the governor said, some of these practices have been in place for 10 years, some of them for months. Democracy in the Park is one of their concerns that occurred in Madison months ago. And the time to file a lawsuit on that is when it actually happens and before people cast their ballots. And I think that's one of the most problematic thing about these lawsuits is that they decide to lie in the weeds, wait until people voted, relied on that advice in good faith and cast their ballots, including Trump's own attorney relied on that advice and casted his ballot, and then wait to see how the election results turn out before filing a lawsuit. And I think that's, disingenuous. It risks disenfranchising people's most valuable right, the right to vote. And, there's longstanding legal principle that you don't get to sit on your hands and wait for an outcome. If you don't get that outcome, then you sue afterwards. So I think today's the right decision, and all these lawsuits, we're very confident that we'll prevail in because there's simply no merit to them.
All right, thank you. Now we move on to Katie Anderson, WBAY in Green Bay. Katie Anderson. All right, moving on to Sean Kirkby with Wisconsin Health News. Sean Kirkby.
Hi, thank you for holding this. Are you planning to mandate that long-term care facility workers get the COVID-19 vaccine when it's available? Or are you going to ask long-term care employers to require the vaccine? Thanks.
Thanks, Sean. As we talked about earlier this week, we have opted into that partnership with pharmacies to provide vaccines on site to skilled nursing facilities. Decisions around taking the vaccine are individual decisions and the decision of that particular employer. So we do not at the state level have any plans to require a vaccine be taken. We want to make sure it is as widely available as quickly as possible, and so are anxious for our allotments to continue to grow as more vaccines come online and more manufacturing capacity is available to push those out to states across the country.
All right, and we go now to Tony Atkins at TMJ4 in Milwaukee.
Hi, yes, my question today is for the governor. I saw your correspondence to Secretary Azar about the need to have the vaccine here in Wisconsin first. Do you feel like Wisconsin's proximity to the storage and distribution center of the vaccine plays a factor? And do you believe that Wisconsin will be among the first states to get the vaccine?
No, I don't think being close to the distribution center has anything to do with my letter. My letter was about the fact that Wisconsin has been unable, for odd reasons like political, to put mitigating factors, opportunities in place that would help us keep the virus from surging the way it has. And so given our circumstances that we have had and continue to have problems convincing people that mitigation is important, especially those people that are in leadership positions in the state. That put us our people at great risk, and as a result of that risk, that happened because of political machinations, that our state is in a shape that we need some help, and that means that we need more vaccinations. The sooner the better.
All right, thank you. And moving on now to Ben Krumholtz, WLUK in Green Bay.
Hi, thank you for the opportunity. Where do teachers and students fall in priority for vaccine distribution? And will it be considered if a school is already learning in person or if they're virtual?
We are awaiting recommendations from a variety of advisory committees at the federal and the state level. I think it is important to note that we don't anticipate the vaccine to be approved for use out of the gate in children. There needs to be some more clinical trials work done in that space. So I think that's an important thing for folks to understand. This vaccine will be most likely approved for use in the adult population only, at least initially. But Dr. Westergaard, do you want to say any more about the tiering and the levels of
those are all right. The ACIP, the federal advisory board that advises the CDC on these, has recommended breaking the distribution into tiers. And when we talk about phase 1A, what that refers to is the highest prioritization of groups to receive the vaccine. And when they met this week, they voted to include healthcare workers, people who provide direct patient care, and residents of long-term care facilities in that tier 1A. So that is likely to be how we implement the very first round, the earliest distribution. And when there's a sufficient uptake in that, we would move on to phase 1B. Phase 1B doesn't have a perfectly well-defined definition right now of what groups are in there, but it will likely include some essential workforce. And those are things that committees are meeting. I expect that the same advisory committee will issue recommendations about what groups of people from what sectors belong in that tier 1B, and then we in the state will have the opportunity to provide our own guidance, our own determination with with stakeholder input in the setting of sort of open dialogue. So those questions remain to be determined, but we're working on them.
All right, thank you. The next question to Naomi Coles, News 3 in Madison. Naomi.
Hi, thanks for taking my question. You touched on the vaccine distribution for frontline health providers. I'm noting in the press release there's about 450,000 of them across the state. Is there a specific time estimate before all healthcare workers in Wisconsin that need one have that vaccine?
Mm-hmm. It's a good question, and it's entirely dependent, for starters, on when you can first put vaccines in arms based on when an application is approved and vaccine arrives in the state of Wisconsin, and then subsequently our allocation in future weeks. We've been told we will get a small allocation as our first allocation, but then we anticipate getting an allocation each week thereafter, and that it'll be different every week depending on how much has come off the manufacturing line, and so it's hard for us to say at this point how the number and our allocation will grow over time based on manufacturing capacity. But we obviously are anxiously awaiting any additional information that we can get our hands on as it relates to the ramp up of manufacturing. It'll also obviously be impacted by how, assuming Pfizer is approved first, because the Moderna application was submitted after the Pfizer one. So if and when Moderna is approved, what's the lag time there? How much can they bring into the manufacturing pipeline? How quickly? So there are a few unknowns in that space that we are waiting to get additional information as this evolves to understand how quickly we will ramp up our allocation here in Wisconsin, and therefore how quickly our frontline healthcare workers can be vaccinated.
Thank you. And we go now to Madeline Anderson, Fox 6 in Milwaukee.
Hi, following up to that question you just answered. So let's say the state is going to get 50,000 doses of the vaccine initially. How among even the frontline healthcare workers are you going to prioritize who gets those? Is it going to be the hospitals that have the highest staffing shortages? Can you just kind of go into that as well?
So the system is set up such that vaccinators or organizations who want to provide vaccine register based on a number of federal criteria. And so we are in the process now of accepting those applications, working through the various questions with entities that want to be vaccinators so that they are registered, they have access to what they need. They can then place their orders. They can tell us how many vaccine they need to vaccinate their healthcare workers, for example, and then we can roll that up into our requests to the feds for distribution to those healthcare providers. So, it requires connection to the Wisconsin immunization registry, et cetera. So there are a number of pieces that we're working on currently with hospitals and other healthcare providers around the state so that they can be connected to the system as vaccinators, so that as we get allocations and we distribute proportionally, we know how many they need based on what they've told us, and then we can push fair share to our healthcare providers moving forward.
All right, thank you. And we go now to Eric Gunn with the Wisconsin Examiner.
Yes, this is for Governor Evers. Thanks for taking the question. You made a lot of announcements today regarding the hospitality industry and assistance for them. What more would you like to see to help that particular business segment, broadly speaking, and from where should that help come? Thank you.
Yeah, and that's a great question. Obviously, if you look at our Department of Revenue data as far as what part of our economy has suffered the most, it is that hospitality area, along with other various industries that are related to tourism. And so we need, obviously they need more help. There's restaurants closing every day across the state. There's lots of people that are hurting in this business, and so that's why we made the decision we made to kind of focus on hospitality. But at the end of the day, the federal government's got to step to the plate, and they've done it once, so we're going to need it again at least one more time, and likely 2 or 3 more times. We're in a very difficult situation if we don't care that the hospitality, tourism, others that frankly hire lots of people in the state of Wisconsin and across this country. If we don't care about them, then we will continue to struggle. But if we do care, we're going to need more federal money so that we can get it to them.
Thank you for that. We now go to Winnie Dorch, CBS 58 in Milwaukee.
Hello. Hello. Thank you for taking her call today. So this message is for the governor as well. Earlier today, you rolled out the $45 million grant for small businesses and restaurants. As we know, moving into 2021, we're still going to be in the middle of a pandemic. It's going to be a while before everything kind of calms down. So do you expect to allocate more money, or how long do you think this will play out where we will continue some federal money to help small businesses and restaurants? Thank you.
Yeah, and we'll continue to prioritize it, but our ability to do something with that prioritization is dependent on our good friends in Washington, D.C. We do not have the resources to do so. They do, and it's our hope that the federal government and the Congress, I know there's some discussion ongoing right now, but at the end of the day, this is a national emergency, not just for bars and restaurants and other hospitality entities, but it is a situation where we need all hands on deck from the federal government. They are the ones that can make it happen.
Thank you for that. We go now to Nate Phelps with Spectrum News.
Greetings, and thanks for taking my call. Are you able to characterize the staffing critical shortages in smaller cities and small communities around the state in comparison to the major metro areas? Thank you.
Yeah, I would say that sort of based on the information, I might connect the staffing shortages more to the number of cases that require hospitalization as opposed to an urban or rural sort of breakdown. But Dr. Westergaard, are you? Do you want to say more?
Yeah, we break it down by HERC regions. So the main population center of the southeast is one region, and we have on the hospital capacity part of our website, we have hospitalizations broken down by region, and we could certainly answer questions about specifically the other regions. We have that, and we're willing to share it, but not off the top of our heads, I don't think can share. But there is variation. I think the message is that all 7 HERC regions, at least some proportion of their hospitals are reporting surge staffing. I think it's about 30% overall. So it's not an urban problem. It's really all of our regions, and the granular detail we could share offline if it's of interest.
Thank you. And the next question to Brittany Ehrman, WMTV in Madison.
Hi, thank you for taking my question. So there are a lot of people who don't want to get the vaccine because they say it either came out too quickly or the long-term effects are still unknown. So what is your message to those who are on edge about getting the vaccine? Thank you.
So I'll say a few words, and then I'll ask Dr. Westergaard to weigh in here. I will say that the FDA process and their public advisory expert committee are looking at the safety data. Should they approve an application, I certainly will feel very comfortable about the safety of that vaccine and will, when it is my turn, be interested in getting one. Again, should they be approved, we'll encourage everyone in the state of Wisconsin to get vaccinated when vaccine is available to them. But Dr. Westergaard, you may want to weigh in more specifically.
I think it's important to appreciate that this was a very rapidly developed set of vaccines by all standards. But it's and that's really an accomplishment. That's a good thing. But it's equally important to understand how what wasn't rushed. So the clinical trials where they enrolled 30,000 people and carefully administered in a blinded, placebo-controlled fashion, and then followed up and got the data, the outcomes data. That was not rushed. That was done by the same standards of all clinical trials. The methods are posted on clinicaltrials.gov. It's been in a transparent process. So we should feel good that the data generated through those trials are reliable. The second thing, which is not being rushed, and the eyes of the whole world are on it, are this process, what's happening next week, where the data generated from those trials is going to be scrutinized for the evidence of effectiveness and for safety by the FDA committee. So that is being done with utmost care, and I think the process, both the scientific process of generating the data and reviewing the data and translating that into clinical recommendations, have been done in a way that is transparent and worthy of trust. So I think when we get to the point where we have an approved vaccine, we should feel as confident as we can for any approved therapy or vaccine that no corners have been cut. I think the public should feel good that process has gone over quite well.
Thank you for that. Next question to Sophie Carson, USA Today Network, Wisconsin. Sophie Carson.
Hi there. Thanks for taking the time. This is for Governor Evers. What's your plan for vaccine distribution if the federal government doesn't give you the money you need by the end of the year and state lawmakers don't act?
Well, we will find the resources. With we've been in a pandemic for 8 or 9 months, and the last thing that your governor will be telling the people of Wisconsin that we got the vaccine, but we're not going to give it to you because we don't have the money. Clearly, that's not going to happen. We will get the vaccine out.
I would add that we do have about $3 million from the CDC that does not lapse at the end of the year, and are currently finalizing an application for an additional about $2 million that if we receive it would also not lapse at the end of the year. So we are also focused on pulling together as many sources of funding as we can to make sure we have what we need.
Right. Thank you. And now to Hillary Mintz from WISN in Milwaukee.
Hi, Governor. Getting back to the Wisconsin Supreme Court decision on the election lawsuit, I know it seems like the president is running out of legal challenges. It could go to the lower courts, but at this point with this decision, how important is it for the president to publicly acknowledge that he lost Wisconsin?
Well, it's clear that he's not going to, so I won't even go there. The president has made it clear in any number of 1,000 ways over the last month that he believes that erroneously, but he believes that this election was taken from him. So he's not going to do it. So the people of Wisconsin, the people of the United States have to move on, even though he isn't.
All right. Thank you, Governor. Next question to Laurel White, Wisconsin Public Radio. Laurel White.
Hi there. Thanks again. Thanks again for doing this. I appreciate it. I wanted to follow up with the governor. Governor, you said earlier that you hope you're able to convince the Senate to come into session soon to take up COVID-19 proposals. How do you hope to approach that? Do you have plans right now to have a meeting soon with the new majority leader?
Well, I assume he'll be on the meeting that we have scheduled. I think it's later today. I'll ask him. I'm guessing it will make no difference, but it's worth the ask. And as I said before, if that doesn't happen, we will consider calling a special session. That seems to be a last resort from my vantage point because we haven't successfully done that in the past.
All right, and our final question to John Neisser, NBC 26 in Green Bay. John. John Neisser.
Hi, sorry about that. Thanks so much for the time. John Erickson sitting in. I'm looking at COVID-19 deaths by group housing setting on the website, and the largest category is unknown, nearly half of the deaths unknown. I'm wondering why that figure is so high. The second highest is long-term care. Thank you. I
think some of that, John, if I remember correctly, is that we didn't we actually didn't start tracking those categories right out of the gate. But if do you know more than that?
Yeah, it's more of a missing data issue, because if there may be changes in the data collection forms and just the inability for locals to keep up and collect all the data on the form. That's been the result. It's not that it's not known, it's just that it hasn't been reported in a way, and there's a number of challenges throughout the reporting process where not every space gets filled in. I think that's one of them.
All right, thank you for that. And at this point, we are out of time, so that does conclude today's briefing. We ask you to continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.